Welcome everyone to this webinar. I'm Pooja Haldea from the Center for Social and Behaviour Change at Ashoka University. CSBC's Behaviorally Speaking is a webinar series where we explore behavioral aspects of different topics. And today's topic is Behaviour Change Post the Lockdown. How do we stay ahead of the COVID-19 curve? We are very excited to host this webinar along with Harvard T.H School of Public Health India Research Center and Project SANCHAR. Now, the last few months have been extraordinary. First a pandemic and then a global lockdown to control it. I don't think any of us expected to experience anything like this during our lifetimes. And this is also very new territory for policymakers across the world because there aren't any templates to follow. After close to 2 months of lockdown, there is a growing realization that this virus is here to stay. And the lockdown can't continue indefinitely. The economic costs are too high. As a result, many governments, including ours, are looking to open up. But as lockdowns open, the responsibility of practicing behaviors that stop the spread of the virus, such as social distancing or mask wearing, it moves from the government to non-state institutions and to individuals. The question then is, how do we encourage people to practice these behaviors, especially since practicing many of these involve individual sacrifice? Policing and monitoring is one route, but it can only go so far. We do need individuals to take greater responsibility. But there are several issues as we go about doing this. Now, firstly, we're all being constantly bombarded by information about COVID-19 and the do's and don'ts from many different sources. Some of it is conflicting. There's also a lot of misinformation. There are WhatsApp messages telling us 20 things we need to do before we step out of the house. Now, this is overwhelming. It's hard to prioritize and it's hard to know what's important and what's not. And this is made worse by the fact that the lockdown has also led to devastating economic consequences for many people. Now, when we are so stressed about our economic situation, how do we create mind space to think about these protective behaviors and take on the additional burden of following them? Further, some of these practices are impossible to follow in a country such as ours. Take social distancing as an example for people who live in the slums. What happens when we are bombarded with messages that are impossible for us to follow? Could it lead to greater fatalism? Could it lead to us not practicing other protective behaviors as well? In a sense, do we just give up? And then some behaviors such as mask wearing can be seen externally and are easier to enforce either by the state or by others around us. But there are others like hand washing, which are invisible and personal. So how do we change these, and that too at such a short notice? We've been trying to promote hand washing for decades, but we still lose 300,000 children to diarrhea every year in India. Changing behavior is hard and it takes time. Further, creating new social norms requires that these are enforced by others around us through some sort of sanction. We want to create a sense of collective responsibility. But how do we prevent this sense of collective responsibility from turning into social vigilantism? How do we prevent it from hurting the most marginalized among us? And finally, what about impact on other critical health issues? COVID-19 and information around it has overwhelmed our health systems and crowded our mind space. But in focusing on this, behaviors and other health issues have suffered. For example, vaccination rates fell by 69% compared to the same month last year. Now, parents not giving MMR vaccine exposed their children to diseases such as measles, which are way more deadly for them. Early diagnosis of TB is falling, and TB kills 400,000 people every year in India. So promoting social distancing and other behaviors related to COVID shouldn't lead to people avoiding health services altogether. So the question is, how do we ensure the right balance? So to discuss some of these questions, we are very excited to have a fantastic set of panelists with us today. First, we have Professor K. Viswanath. He's the director of the Harvard T.H School of Public Health India Research Center. He's also the lead key professor of health communication at Harvard Chan. He has an extensive track record of research in the US and globally on the role of communication in health and well-being, with a particular interest in issues of inequalities and poverty. Today, he will talk about this in the context of the current pandemic and how better communication can enable the behavior change we seek. Then we have Dr. Pavan Mamidi, who is the director for the Center for Social and Behaviour Change, and he brings to this discussion his expertise in applying behavior science to solve social problems. And he'll talk about how we can use these strategies post-lockdown to create new social norms. Then we have Dr. Sanna Balsari-Palsule. She's a behavior scientist and works with both the private and public sector to apply evidence-based insights from psychology, behavioral economics, and neuroscience to improve people's lives. And today, she will focus on how behavior science can be used to create desired behaviors at an individual level. And lastly, we have Elizabeth Serlemitsos, sorry Elizabeth, I did it again, who directs Breakthrough Action, a 5-year initiative funded by USAID to lead its social and behavior change programs globally. She has worked in the field of international development and public health for more than 30 years, 26 of those while residing in Africa. Today, she will share her expertise in public health response, especially her work during the Ebola outbreak and how learnings from that can be applied today. So welcome to all of you. A few words on how we will run this webinar. First, Vish will start us off with his keynote speech. It'll be followed by each panelist giving an opening remark and then followed by Q&A. Now, we've disabled the audio and chat for the audience, but there's a tab at the bottom of the screen to submit any questions that you have. So please keep sending them to us. We're also live on YouTube. The link is available on our Twitter handles. That's 3 of them, CSBC_Ashoka Univ, Howard Chan IRC, and Project_SANCHAR. You could also follow our hashtag behaviorally speaking to catch our live tweets or tweet about the webinar yourself. All right, so let's start. We'll start with you, Vish. Over to you.
Great, thank you. I'm assuming that you can hear me. So,
yes.
Thank you for having me. And I also want to thank everyone on the CSBC team at Ashoka, as well as the Harvard's India Research Center team who have been working very hard. And I'm delighted to be here. It's a great pleasure to be here. I do want to start with a couple of generic remarks in terms of expressing, gratitude and thankful that, it's a kind of a blessing that some of us are realizing pretty quickly that we are able to talk remotely, work from home, and do a lot of what we are able to do. But we should also be thinking of a lot of people who are not able to do or enjoy the privileges that we have. People who are suffering from cyclone in India, in Bengal and Bangladesh and others, hundreds of thousands of millions of migrants who don't have these privileges. So it's certainly, I think, in a time to be count our blessings and be grateful for what we are doing and what we are able to enjoy. It is also important to do these, conversations or engage in these conversations with a certain amount of humility and not hubris. And I say this with some assertion in the sense that a lot of what we know and a lot of what we are saying today, we could be wrong tomorrow. I think, we don't know a lot than what we know. And we have been making some assumptions about science, about infections, about vaccines, about social behavior and health, individual behavior. But we could very well be wrong, I think, and I think, we need that humility to see that, that we need to constantly think and monitor our own assumptions around these things. There are 2 major features of this current crisis, which makes it really difficult and different from anything else we have seen. I think that's very important to think about as we talk about health behaviors. What is different about this crisis? We have been trying to reach back into the past, going all the way back to the Spanish flu and even beyond, or we are now talking about SARS, about MERS, about Ebola. But this is completely, in many ways, it's very different for 2 reasons, I think. One, we have expected and we have mandated behavior change at a massive scale, unlike anything we have ever seen. Theoretically, at least 7 billion people in the world have been asked to do a certain set of things that they have not been doing. And we have asked them to do it in a very compressed time. Of course, if you go back and look at behavior change programs. We have promoted a number of behaviors, but immunization is a good example of that. But our tobacco control is another example. But we have done that over a period of time. But nothing like this, where we have expected people to really comply with the recommendations and change their behavior in such a compressed time on such a massive scale has never been done. I think that's something to remember, remind ourselves of. The second thing to remind ourselves of is, at no other time, the work of science is facing such public scrutiny. Usually, scientists work and their benches are labs, or dry labs or wet labs, whatever they are. We have people peer review our articles, our studies before they are published. A couple of people pay attention to what we do. Maybe a few people read and cite it. But it takes, really years or decades for our assumptions to be confirmed or disconfirmed. And very few people pay attention to it. But on the other hand, I think today, more than at any other time, the work of science is very public. It's there the next day, whatever you do today, and that provides a particular challenge, I think. So what are we trying to do here? So what I'm going to do is give you a brief bullet point issues that are worth discussing, given the tremendous expertise on this panel. I cannot, and short of time, cannot elaborate on each of these things, but just let me put some ideas on the table for a conversation here. One of the things we have to, what are we expecting people to do, right? A very few things: maintain personal hygiene, hand washing, or cover your nose when you sneeze and cough, or wear face masks, maintain physical distance, disinfect surfaces frequently. These are very fairly straightforward, quote unquote, simple behaviors, right? It's not that each of these behaviors by itself is controversial, but a couple of things are important to remember. One, people are expected to do all of them. They can't skip any of them, right? So if you think about it, and I'll come back to this point again and again, is complexity is the enemy of compliance, right? So people have to do all of these behaviors all of the time, to really keep the infection from spreading. That is going to be a challenge. The second thing, that is a challenge with this behavior change process we are beginning to embark on is, it is not wise to talk about behavior by itself, forgetting the word social, right? Because it is this practice of behaviors and how it affects individuals that is important. It does not affect all individuals equally, right? The social component becomes extremely critical here. So the issues of inequalities and poverty are central, are the lenses through which we have to look at this behavior change. So if you think about what shapes human behavior, you can think of an onion, right? So you have to think of layers of onion. At the very core, there are sort of individual factors. This is not rocket science. There are 50, 60, when we were working on our book on health behavior, we found there are at least 60 to 70 different models and frameworks and theories of behavior. At the very core, they fall on a few core set of factors. One of the most critical factors I think we are going to spend some time talking about here is the perceptions of risk or threat, right? So we have faced, thanks to media coverage, thanks to government's mandates, a massive threat at the same time. And people are perceiving that risk. The risk has been magnified, and therefore it is complying and compelling certain set of behaviors among people. The question is, what happens when, number one, when the perception of risk, the threat level goes down, at least in terms of perception. Second, how long can you maintain that threat, right? That risk of threat. And third, how can people from different backgrounds can relate to and behave under this threat, right? Not everybody can do what we are doing. So we are going to do some things, based on honor system. I think some of the other people will talk about it. We are going to rely on trust people, to declare the symptoms or stay at home, right? And the other is the other part of the onion layer is the interpersonal family context. It is not at all unusual in many parts of the world that multi-generational families live together, right? And that we are not automatons, individuals. We are actually a part of a system of families, and that influences a lot. What do our significant other people do? Reference, as we call them, whether family members, friends, neighborhoods, right? The institutional context matters quite a bit. We published several papers on this, and one paper which is relevant here is, if you perceive that you are going to lose your job, that's if you do not go into work, that's a very, if you don't have sick leave, that's a very different set of compulsions and imperatives that will influence your behavior compared to others. The last one, that shapes human behavior that we haven't spent, we talk about it, but we are very, not particular about certain about measuring it, is because it's so difficult to measure, is culture. Culture is very important. In different parts of the world, touching, hugging, kissing, handshaking are a part of it. And now we are asking people not to do it. What they have done for hundreds of years, they are being asked not to do it, right? Or cremation practices, or burial practices. We are asking people to change, I think. And the social conditions of poverty. So what stops people from what are the barriers from engaging in these behaviors? As I said before, I think it is individual behaviors. You are expecting individuals to act in a certain way, but your social class, what you see depends on where you stand. As I said, we are talking about, if you are a migrant worker, you see the conditions and the recommendations and the guidance and the guidelines very differently if you are different, you have people like us that are talking and working remotely. Your employment conditions influence your behavior. It's a major barrier. Who can work remotely as opposed to, you cannot clean buildings remotely, right? You cannot, go out and work, do manual labor, remotely. So these people are affected. We are increasingly finding out digital divide matters. We have been publishing, data on digital divide, but a lot of people have not taken seriously in the last 2 or 3 years, assuming that cell phones will solve all the problems. All of a sudden, we have recognized, waking up and saying, this is a huge divide. Not everybody has access to these kinds of technology services, right? Density of residence compels you. How can you maintain your physical distance, whether it is 1 meter or 2 meters, when you are 6 people living in a small 2-room apartment or a house? The continuous barrage of coverage in the media, both misinformation, disinformation, is really generating a sense of fear, guilt, among people, compelling them to really, do certain things or say certain things that they would not usually do or say. So then I want to end here by saying, what are the enablers? What can we do to enable this kind of a behavior? As I said, one is, the theme to remember is complexity is the enemy of compliance, right? How can we make this behavior easily practicable, right? How can we facilitate conditions that can allow people to practice this behavior? These behaviors we are recommending, right? So one size doesn't fit all. Certainly we need broad national global strategies, but frankly speaking, as different countries, different regions of each country are at different stages, we need to develop some customized strategies and make it easy for people. The other is in terms of mobilization, right? I'm really increasingly becoming concerned, this notion of compliance through collective punishment or the penal approach we are taking. It's not a law and order problem. And law and order frame that is being used to promote risk and promote compliance is not going to be sustainable. What we need is collective mobilization, strategies to collectively mobilize and get people to buy into this argument. At some point, we need to rely on people. We need to rely on our neighbor, the so-called social norms, right? But how do we do that? How do we really mobilize people to really become, a part of it, right? We need that kind of a participatory approach where we engage people in the conversations. They have to become a part of the solution. They have to co-design these solutions for us. It is not that we are going to sit in Washington, DC or London or New Delhi or state capitals and mandate these recommendations. How do we engage and allow people to develop these solutions with us and comply with this risk, not from a law and order perspective, but a collective mobilization perspective. Role modeling, somebody has asked me about, what politicians have been saying. It is really critical for, influentials, people in authority, people who have some kind of a social power. We need inspiring stories to model, because modeling, we know, makes a major dent in human behavior. Actually, people are more likely to comply if you see models. The question is, how are you going to model this behavior? And then we need some kind of making sure that equity becomes a lens through which we practice and promote these behaviors. What that means is really facilitating social conditions where people feel safe to practice either at work or home. And if they cannot practice, they can come forward to say why they cannot practice so that the conditions can be facilitated for them. The last thing I want to say, and I want to stop here, as I said, these are like a bullet point issues. I'll be happy to elaborate. I don't think we will have a ready-made solution for everyone. I have said that, but it is important, especially for policymakers and others, to understand we need to develop a sense of a learning culture. We need to try out different experiments, because it is very difficult to predict what will happen, precisely because what I said earlier, we have not seen anything like this. We can learn from the past, of course, but it has to be very carefully thought through. And we need to understand, we need a kind of a learning culture where we will continue to experiment and monitor what guidelines, what programs, what communication campaigns are working or not working, and should have the agility to change them right away. I think that kind of a learning culture, that experimentation, that agility is important in case we are promoting these behaviors. At the end of the day, I will stop here after this. We have to think about humans, and humans are a part of a social system, a cultural system, right? And we have to think about where they are coming from. If we do lose that sense of humanity, that humanness, I don't think, any amount of compelling will work. And we cannot continue to think of, otherwise, we will be blaming people for doing this. The migrants are responsible for this. The Chinese are responsible for this. A group is responsible for this. We'll stigmatize them. We'll be blaming the victims. I think it's very, very important that we do not forget our humanity as we begin to do these things. Thank you.
Thank you so much for that. I mean, it's a wonderful overview on what we are going to talk about today, and a good reminder on, for us not to forget our humanity as we go about designing and solving, the problem in front of us. So I'll ask now, Pavan, for you to take us through your opening remarks.
You're on mute, Pavan.
Pavan, you're on mute.
Yes. Thank you, Pooja, and thanks, Vish, for the excellent perspective of the challenges that lie ahead of us. I want to organize what I want to say into a couple of main points. At the very outset, what I would like to do is propose a very simple typology of the kind of levers that we have at our disposal to try and change behavior, if we do want to change behavior, to make people more compliant of what is appropriate behavior and so on. The typology includes the following main categories. The first category, of course, is formal institutions. formal laws. A law is a state-granted mechanism which imposes an expected cost for anybody who engages in prescribed behavior. So essentially, the legal system is a shopping list of prescribed behavior, where when people don't comply with the law because they are in pursuit of something privately beneficial, they get punished. The second big lever that's available in society to produce required behavior is, of course, social norms. And by social norms, we mean informal institutions, laws of formal institutions. And social norms are essentially mechanisms which continue to impose expected costs on prescribed behavior, but the source of the sanctioning is not the state, it's not the formal state, but it is private individuals. And so social norms are fundamentally different from formal institutions. We need this typology because we need to know what is going to happen once the lockdown withdraws. And of course, the third lever is incentives, which we clearly can't use because we can't incentivize appropriate behavior each time we expect somebody to maintain social distancing or wear a mask. You can't give money or candy to somebody and expect them to wear a mask. And of course, finally, we have the sort of the emergent toolbox of behavioral economics, which is to use a choice architecture and shape choice architecture in such a way as to extract appropriate behavior. So there are these 4 or 5 broad categories that we can potentially use in trying to change behavior. But let's go a little deeper into social norms, because the 2 really major ways in which you can change behavior is formal institutions or informal institutions, social norms. Nudging has a certain role, but it's more a sort of an ameliorative skin that you can add to the tools at our, the levers at our disposal. So what is a social norm? There are 2 important perspectives. The first is that it is an expected cost. It still is an expected cost, much like a formal law. And, but except that it has to be imposed by your fellow citizen and not the police officer. Right? That's one key thing that needs to be understood. And the second perspective of social norms comes from, Christina Bicchieri. She's this wonderful and amazing theorist who talks about social norms as a set of expectations. You either have empirical expectations or you have normative expectations. Empirical expectations is a set of beliefs that an individual can have about what others are doing. If you have, for instance, accurate information that 90% of society is paying taxes, that forms a certain set of empirical expectations, what others are doing. Normative expectations, which also comprise social norms, talk about what others approve or disapprove. So there's a sort of a moral, axiological understanding of behavior there, right? So by changing expectations, you can change behavior. That's Christina Bicchieri's main thesis. Now the challenge before our society is the state is withdrawing, and if the state is withdrawing, its ability to monitor people's behavior is going to be diluted. They will not be interested in, the police officer is not going to stand on the street and determine whether you're going to maintain social distancing or not. You have to do it yourself, right? And because the state is withdrawing, monitoring is going to come down. State-led monitoring is going to come down. So now you have to essentially rely on a social mechanism of monitoring each other's behavior and a social mechanism of imposing sanctions or expected costs on each other. And that is a humongous task. If only for the reason that social norms take forever to find an equilibrium in society. I mean, some of the norms that we practice have been inherited over, since humankind began, right? So now to expect to create social norms and distribute these social norms, these mechanisms of privately enforcing sanctions on each other in a very short span of time, which Vish talked about, in a compressed time, is going to be a massive challenge. And this challenge, so one of the ways in which we can overcome this challenge is by potentially using communication, right? It's messaging. So you got to sort of, in some sense, embed social norms in strategies of communications, in communication campaigns, and then rampantly distribute them across society. So that's a huge challenge. But what are going to be the components of this messaging framework that you're going to create for the government or for the state? The first set of messaging should focus on the fact that the responsibility is being transferred to the individual. In other words, it's like telling your child that I'm not going to watch your behavior. You're going to be personally responsible for your own behavior, and not only your own behavior. This is the clincher. Not only your own behavior, but the behavior of your fellow citizen. And that's something that needs to come through in your messaging very, very clearly. The second component that's going to sort of play out very actively is the reminder of the existence of the norm itself. Once you have proposed the norm, you got to actually say that this norm exists. And a lot of non-compliance of norms arises on account of the lack of salience, because people forget. It's not because of moral turpitude, or is it, and it's not oftentimes because of a deliberate intention to violate the norm, right? So by creating a mechanism of just politely providing reminders of the existence of certain expectations in our private day-to-day transactions in social spaces is something that we need to promote. And the third, and possibly the most controversial part of this whole thing, and I will stop there, is to introduce the idea that now you're emboldening people, that you are now transferring the responsibility to private individuals to use their ability to impose a certain measure of sanctions on others who don't comply with the behavior. And that is the tricky part, because now you're beginning to transfer a certain responsibility which is normally held by the state to the private citizen. And this can be extremely dangerous, right? Because now you're granting a person to punish somebody else, to punish each other. So how do we sort of balance that power to ensure that it does not produce conflict? That's going to be a challenge. So you need to calibrate that very carefully to ensure that it doesn't lead to, what Pooja said earlier about vigilante justice, or it does not lead to conflict, or it does not lead to a discriminating, an unequal application of the norm across different marginalized groups, for instance. Because one of the most effective, history tells us that one of the most effective instruments of oppression has been the unequal application of social norms across different groups in society. And so if we are going to be transferring a tool of sanctioning each other, and that becomes a basis to go against, marginalized communities, or to go against women, or to go against certain communities, then we would have defeated the very purpose of creating these social norms in trying to save our society from the great dangers of the pandemic. Let me pause there. Thank you.
Thanks, Pavan, for fantastic comments on social norms. And we will come to asking you questions around some of the tricky things that you've raised, in your talk. So I'll now request Sanna to talk about the individual.
Thank you, Pooja, and thank you again to all those involved in bringing this together. Now, until now, we've talked a little bit about the collective and the responses to the pandemic at the level of society, institution, and community. But what I want to do in the next few minutes is to shift our focus from the collective back to the individual. Now, what happens in a crisis like a pandemic or a disaster is that we have a tendency to view people as a mass. We look at individuals through the lens of demographics, such as vulnerable age groups, income, urban and rural, but what we critically overlook are psychographic and behavioral differences. Now, as we emerge from this lockdown and we plan interventions to maintain adherence towards key preventive behaviors, it's important to understand that we can't take a one-size-fits-all approach. We need to be able to answer questions such as, why are some people more responsive to preventive behaviors, such as wearing face masks, while others are more likely to show deviance? Or in the face of a looming mental health crisis, who is most at risk of anxiety and of stress? Now, when I talk about the individual, I could talk about cognitive biases or countless theories of motivation, theories on motivations, attitudes, perceptions, and these are all important. But one of the most critical elements of individual behavior that often goes unnoticed is the science of personality. Now, there's a caveat here, which is that we know that any aspect of human behavior doesn't occur in a vacuum. And as Vish said, there's an entire social ecology of influential factors from family to culture. But even so, personality is highly relevant to the adaptive and maladaptive reactions that we can take in this pandemic. So let's take the example of a preventive behavior such as physical distancing. It's safe to say that across the board, we're all experiencing some form of behavioral fatigue. Over the last 2 months, we've not only had to learn new behaviors, modify existing ones, but also maintain them. And as Vish said, it is highly complex as it's all happening at the same time. Staying in this state of constant high vigilance takes cognitive effort. And this is where we can detect a few patterns in personality. Now, when I talk about personality, I'm referring to today the Big Five framework. This is the most widely used framework for psychologists, and it really sees human behavior as made up of 5 traits: openness to experience, conscientiousness, extroversion, neuroticism, and agreeableness. So let's take the example of extroversion. We know that extroverts tend to be much more risk and reward seeking than introverts. They thrive on stimulation, and they also have a lower risk perception than others. So based on what we know, we would expect that as lockdown rules relax, extroverts may find it more challenging to adhere to specific behaviors, and they're more likely to perhaps be impulsive. The rewards for complying to social norms may start to wear off for extroverts. And without the immediate visible threat, the rewards of breaking rules and seeing friends may start to appear more palatable. And in fact, a recent study in Brazil, researchers found that extroverts are find it more difficult and actually maintain social distancing at a lower rate than introverts. Another personality trait that's relevant here is conscientiousness. So this is people who are highly disciplined and planful. And as we'd expect, researchers in the same study found that people high in conscientiousness are much more likely to maintain personal hand hygiene practices as well as physical distancing. So these are just a couple of examples, and we'd expect patterns to emerge across other traits and behaviors. However, when we talk about personality, there's an interesting nuance that I'd like to briefly mention. Psychologists typically classify situations as strong or weak, and it's something that we call situational strength. So in a strong situation, behaviors are being driven by external forces. And in a weak one, they're being driven by internal forces, such as your personality. Now, COVID-19 is an example of a highly unprecedented, extremely strong situation. Rules and norms are entirely prescribing our behavior. And what's happening is individual personality is being crowded out. Now, what happens in this kind of situation is that people find themselves either amplifying or suppressing certain traits, or experiencing dramatic fluctuations and variability in their day-to-day behavior. Now, we could take many examples of this, but let's take the example of neuroticism. So this refers to people's emotional sensitivity and reactivity. In this pandemic, for many, neuroticism is likely to be fluctuating wildly. One day you might be filled with dread and anxiety and stress, and other days you might have this kind of calm acceptance of our new reality. Now, this kind of adaptation that is happening in this pandemic, on top of everything else that we're experiencing, is exhausting, and it is mentally draining, because ultimately people are just not able to be themselves. And this leads me to my final remark around individual differences in mental health. As with behavioral fatigue, we've all experienced some level of stress in this pandemic. Now, as we know, stress is a natural human response to any threatening situation, and it's a survival mechanism. However, COVID-19 is not just a short-term stressor, it is a chronic stressor. It's requiring us to continually adapt to a situation that is both highly ambiguous and highly uncertain. Now, facing this kind of uncertainty takes a huge toll on individuals, but it is significantly harder for people who are high in neuroticism. People with high levels of neuroticism are already more vulnerable to depression, to anxiety, to PTSD, both from the experience of quarantine, but also this continuing uncertainty. Another behavior that's important here is what psychologists call locus of control. Locus of control is the degree to which people feel that they are in control of their lives. So individuals with a strong internal locus of control believe that events are happening to them as a result of their own agency. On the other end of the spectrum, individuals with a strong external locus of control believe that what happens to them is out of their control. Now, in a time of COVID, these internal narratives are hugely important, as they dictate our coping mechanisms. They dictate our resilience and how we're going to deal with the ongoing anxiety and stress. So I've given a very brief snapshot of how we can use a deeper understanding of individual behavior. And I think the next steps are really to think about how can we overlay this understanding to design interventions, to bolster interventions, whether they're around kind of social norms, communication, or messaging. So I'll just pause there.
Thanks, Sanna. It is a very different and interesting perspective that you've brought to this topic. And yes, we will come back to that question on, how can these personality differences be accounted for when you're designing policies or when you're putting together policies. It's an interesting question to think about. So before we go into the question answers, we have Elizabeth. So Elizabeth, over to you to talk to us about your experience, especially of some of the experience that you've had in past outbreaks of sort of similar nature.
Thanks very much, Pooja, and to the other members of the panel. Really fascinating. I've been sitting here taking lots and lots of notes because there's so many points I want to touch on, but I know we won't have time for all of that and any meaningful discussion. So let me just make my few brief remarks. As Pooja mentioned, I have had quite a number of years working on various epidemics, which it never really occurred to me that I had been doing until quite recently. I started my career sort of in the era of HIV, and I didn't quite plan to work on HIV, but ended up in Southern Africa in the mid-1990s when there was an epidemic happening. And we all ended up getting quite involved with that. And fast forward to 2014 when Ebola struck in West Africa, and I was in a situation where I was available and headed out to Monrovia and was based in the Mano River region, working in Liberia, Sierra Leone, and Guinea for about 18 months throughout the Ebola outbreak, and now, of course, is COVID-19. So that perspective has enabled me to reflect actually quite a bit on outbreaks or epidemics and the nature of the human behavior involved in preventing the spread of disease and so forth. I just thinking about sort of comparing and contrasting those three epidemics. HIV is one that, as you well know, involves a lot of what we might consider more private behaviors, the things that are not visible to others besides perhaps a sexual partner. And although the negative result of contracting HIV, I mean, up until relatively recently when we have pretty effective treatment and have turned HIV into a chronic disease, HIV in the 90s had 100% fatality rate. So it was a pretty severe result. As contrasted then with Ebola, where that level of risk really was much more at the household level. That if you had a sick patient in your home, you were at very, very high risk. But if you were outside the environment where people were visibly sick, the risk actually wasn't really very high. And so the behaviors that you had to practice were much more contained within the household level, and imposing things like a quarantine on a household, although it felt very difficult at the time, was actually comparably easy compared to COVID-19. And then when we move on to COVID-19, we're seeing a whole different context where we have a respiratory infection. This is something that we now know is transmissible by people who don't have any symptoms. It's transmissible in public spaces, and people don't even know that they've been exposed. And so we have ended up relying on a mix of behaviors that are preventative to the individual. So the things that individuals can do, like hand hygiene and so forth, to help prevent themselves from getting an infection. But it appears at this point, and as Vish said, the science is you know, continually evolving, and we're learning more and more. And I think that adds to the complexity of this situation because our messages are shifting. But we, as we go out of the lockdown situation, we really are focusing more and more on the behaviors that we are asking people to practice to protect other people. I'm thinking particularly around mass mask use. And mask use is not as far as we know at this point, is not a protective behavior for the individual practicing the behavior. So that changes a whole lot around people's thinking about how to practice a behavior, because I can sit here and say, I've been in my home for, you know, weeks and weeks now. There is no way I have COVID-19. So why should I bother wearing a mask? But if I don't wear a mask, even though I know I have zero risk of infecting anybody else, then I am feeding into the complexity around changing the social norms. So I'm making it more difficult for anybody else because they see that I'm not wearing a mask. So they're going to say, well, I don't need to wear a mask either, even though maybe they've been out to the supermarket or have had some exposure somewhere that they weren't aware of. I had one or two more things. So around those norms, I think it's a really interesting perspective on thinking about norms connected to kindness and norms connected to doing things for the good of other people. New York State, as I think many of you know, New York City has been, of course, one of the epicenters of the epidemic here in the United States. And in New York, they actually started to crowdsource and invited people to develop a series of television commercials, television spots, and they have sent those out. I think it's maybe on Twitter or something, I'm not sure, for people to vote on the one they like best that will then be used. But that whole process of engaging people in thinking through the development of the messages, I think, again, this is something that Vish was talking about, that whole engagement in the thinking and engagement in the process is part of bringing people along. But I was looking at those spots last night, and the range of messages, of course, is across that whole spectrum of what we would want to be looking at, from the message around being kind and wearing a mask to protect others, combined with one where the people are specifically calling out, I'm asking you to protect my mother, I'm asking you to protect a health worker, I'm asking you to protect somebody else. To the other end of the spectrum, we're calling out that guy, the one who's not wearing the mask, and trying to create some normative behavior about that. I just thought those were really fascinating, and the whole approach to it was fascinating. I am very mindful of time because I know we want to have some discussion, but I did have sort of two other points I wanted to make, and one was around the nature of behavior in general. And I think Vish touched on this as well, which is that you have those behaviors that are kind of a once-off behavior, and asking somebody to do something once off, like get your child vaccinated or something like that, is a relatively easy behavior to do. It's kind of a yes-no pinpoint. The other end of that spectrum is those lifetime changes that are a little bit more lifestyle, and those do have a level of complexity, you know, diet, exercise, and whatnot. But I think what we're facing right now is something that's in the middle, and we're asking people to change a behavior for a period of time, and yet we don't know how long that period of time is. And there's so much that we don't know about the behavior that it becomes incredibly complex to think about how to address those changes and how to ask people to make those changes for some indefinite period of time. And then finally, again, Vish had described this, but for me, in all the work I've done, this has been one of the just overarching theoretical approaches, which is the expanded parallel process model, or threat efficacy, and that constant need to make sure we are balancing the level of threat perception or risk perception with the self-efficacy to practice the behavior. And it's a constant need to keep those two things in balance. We need to make sure that that people perceive a high enough level of threat or risk but at the same time know that they have the capacity to do the behavior that's required of them. And I think I could wrap it up there, and any other points I'll bring into the discussion. So thank you so much.
Thank you so much, Elizabeth. So what we'll do now is that let's start with a few questions from my end, and feel free to jump in as in when you have something to add. And then I'll go to, there are lots of questions which have come from the audience as well, so I'll take some of those. So maybe I'll start with Vish, you. You talked about, sustaining risk perception and so on. And we've recently seen some research in India where we see that, in parts of rural India, actually people don't perceive the threat at all. I mean, the feeling is that this is a city, it's a disease of the city people. And frankly, the issues they are dealing with is more of loss of income, economic uncertainty. Now, in that sort of a situation where, the threat perception of the disease is already quite low, and there are other issues which are sort of preoccupying their mind, what kind of communication strategy would work in that situation?
Wish your microphone is on.
Wish you're on mute.
Yeah, okay. I believe you have to turn on your microphone for people to hear. So that by itself is not very difficult, right? So we have almost 30, 40 years of communication campaign evaluation experience, where we can really work with people in terms of changing priorities, in terms of perceptions of risk. So people are very smart, very intelligent, very rational. And they're always evaluating risks in terms of costs and benefits. And certainly, if I see, something A versus B, but, I would rather, if B is something that is affecting me much more, so I'm likely to practice B, I think, right? It's not at all difficult to do that. I think the issue there is, I think we have done very successfully. I think tobacco control is a good example. I think globally, if you look at the numbers, we have been very successful in actually amplifying the risk and shifting, the priorities of people in looking at risks and perceiving risks in a magnified way. So in a rural areas, if you see that the risk is the level of threat is low compared to other things, right? I think you have to do two things. Number one, through communication campaigns, you can increase the perceptions of those risks. And there are varieties of strategies of doing that. I think Elizabeth began talking about them. And we have a huge body of work in communications that can help you do that. But that by itself will fail if you do only that by itself. You don't address these other conditions, right? So if I'm very hungry, if I'm worried about my crop failure and getting my crops to the markets, or things like that, and if you don't solve that problem, but only focus on the risk of the moment, it is unlikely to work. We know that, again, from campaign literature, that you have to really make sure that you have to make sure that you can manage these other threats while you're focusing on them on this threat, I think. So it can be done. One thing we haven't talked about here is to think about, despite what we say about people and the way they behave, a large number of people in the world are complying, right? I mean, it's an amazing thing to behold. Actually, there are more people complying with the recommendations than people who are violating it, right? So we should step back and think about what is it that is making people to comply. We can focus on the deviance, but certainly think about, what has made people to comply? What has made people to identify with that threat and comply, rather than just to focus on what has not been done or what is not being done, I think. So anyway, I'll stop.
Maybe a follow-up question to that would be, you talked about, in enhancing this risk perception, and there are many ways to do it. Do you also see that, I talked about earlier that when you sort of talk about risk of COVID, what about risk from other health conditions, which exist in parallel? Do we risk over emphasizing on COVID risk and therefore, reducing risk perception on other things? And how should a country like ours balance that?
Yeah, it's just not a problem in India or some, right? This is a global problem. I think in one other conversation, Pavan and I were talking about issues of scarcity, right? Issues of bandwidth. At any given time, human beings have a finite bandwidth of thinking about a few problems, right? We have interviewed a lot of people who are poor. When you are poor, you are buffeted by so many things. You have to make a decision. What is it you will focus on at any given time to solve and address it, right? And that's what is happening right now. So COVID-19 there is this kind of a saturation coverage, right? Elizabeth had a great recommendation. Stop watching media in some ways, because I think to maintain our own sanity, there is this kind of a saturation coverage, and it has just sucked the air out of everything else. And what it has done, now data are actually coming out. It is affecting other health behaviors, right? So Sanna talked about mental health. Stress is associated with risky behaviors, tobacco use, alcohol. We are actually seeing that. Domestic violence, we haven't talked about domestic violence here at all. Immunization rates are coming down. A new report has just come out yesterday in the US from CDC. Actually, immunization rates are coming down. Cancer screening is going down. So I do think, you mentioned in your opening remarks so nicely, screening for TB, etc. It is worrisome. It is worrisome that I think it is going to affect other parts or other lifestyles, other behaviors, other preventive behaviors. And this is going to be a challenge. That's why I'm saying this is not going to disappear today or tomorrow. This is going to live with us for a long time to come. The latest World Bank report says 60 million people will fall into poverty. Just think about the magnitude of the problem of that, right? And everything, right? So if you're in poverty, again, how many people will engage in healthy behaviors? So you're absolutely correct. I think that's why I was saying we don't have a solution. We have to be really agile in developing the solutions for each of these things.
Pooja, maybe I could just contribute that certainly we in the microcosm of Ebola also saw the health impact of the Ebola outbreak, because people's fear of Ebola was so elevated that they stopped going to health facilities. And the result of that was, I don't have the data at my fingertips, I'm sorry, but I think that more people died of malaria in the Ebola affected region than died of Ebola during that period, because they were not going to get health services when they needed them. And the other piece of that puzzle is kids were out of school for an extended period of time. And the rate of teenage pregnancy in Sierra Leone skyrocketed during Ebola, because you had all those kids who were not at school and did start to engage in in sex, and that resulted in a lot of pregnancy. So there are untold health implications that we already know are going to happen. But I have appreciated seeing in some places where they have really been focusing very heavily on ensuring that health facilities are sanitized and then promoting that to rebuild trust in the facility, to encourage people to come for routine services and to come for other medical services that they require, and that they are able to maintain their trust in the health facilities.
Thank you for that, Elizabeth. So shifting focus a little bit, Pavan, I wanted to come to you, and I also see a lot of audience questions on this. You talked about social norms, you talked about, sanction, and you also referred to saying that, the sanction should not turn into something ugly. So do you have, how do we prevent that from happening? I mean, what are ways in which we can make sure that these reminders and this reprimanding or sanctioning is done in a respectful way without resorting to negative behaviors?
So this is a great question. It's not an easy question, but I could perhaps take examples of how a mild form of reprimanding and sanctioning can be done in a respectful manner. Take, for instance, the speech act of reminding somebody of the existence of a norm. You can do it in either of two ways. You can do it softly and tell the other person that, hey, listen, this norm exists and you're not complying with it. You can escalate your voice in a little bit so as to attract the attention of community members to notice that the other person is not complying with it through the reminder itself. I mean, flight crew are spectacularly good at this, right? I mean, when people violate norms of behavior within an airplane, they don't punish the people, but rather they mildly raise their voice with an option of deniability to draw the attention of everybody within the community to notice that somebody is actually not complying. And that can be a fairly effective way of getting people to use sanctioning in a way. Sanctioning may not be the right word, actually. It's reprimanding. It's not even reprimanding, it is reminding somebody of the existence of a norm, which is the first step to making a norm salient. And the sanctioning part can come at an extreme case. So let me pause there. But it's not an easy question to answer, because
that's an interesting example you gave from the airlines, where the norms are enforced but in a polite manner.
That's right. I mean, saying sir, for instance, or saying bhai saab or behenji is a way of deflating or preempting the conflict, but at the same time, in some sense, sounding self-indignant that you're not only affecting your welfare, but not only you're affecting my own welfare, but you're perhaps affecting your own welfare and your family members' welfare by engaging in this behavior. That could be a potential way of doing it. But this is certainly something that needs to be investigated and thought very carefully. But it can be dangerous otherwise.
In fact, Sanna, so there are a couple of questions from the audience as well, and even I had this thing in mind. You talked about personality. Now, obviously, even if you use the big 5 frameworks, we come up with many personality types. But when the state or government or policy makers, they're designing policies, what is a practical way of taking the personality differences into account?
Yeah, and it's a very good question, and it's a controversial one as well, because if you think back to Cambridge Analytica, that was essentially based on segmenting voters by personality, by the big 5, and then crafting messages based on that. So that's kind of one route in terms of actually understanding and segmenting a population based on who is highly neurotic extroverts. I think when I talk about personality, and I mentioned locus of control as an example. Personality scientists have long argued about this, whether personality is stable or if it's changeable. And I think we've now reached a kind of consensus that our personality traits are relatively stable, but there is a degree of flexibility, and we change our behavior according to different situations. When we have behaviors such as locus of control, these are behaviors that we can actually shape. So you have someone who is high in neuroticism. That means that they have a natural propensity towards developing more anxiety-based disorders as stress. But what we can change is their locus of control. And so I think one way to look at this is, how can we design interventions around mental health that are targeted at kind of sub-behaviors within personality traits, such as locus of control, such as one's kind of concept around psychological resilience. So I think it's a very good question. We're in the very early stages of this. And as I said, personality is very much one building block, and it's kind of a way of, it's an overlay that we can have for our interventions, but it's a useful lens, I think, to see and determine kind of interventions to change behavior.
Right. So can I?
Please go ahead, Vish. Yes.
Add one point to this, I think, right? So, and I really liked what Sanna said in terms of modifiability of personality, right? Is it mutable or is it fixed? and to a large extent, it's stable, as you rightly pointed out. And I think the challenge for us is what we are talking about, moderating behaviors, right? We are not going to eliminate certain impulses, certain ways people act. I want to eat that extra cup of ice cream or extra sweets, but what I need to, and that will never disappear. You can't completely eliminate those things, but or I want to stay home, or if I'm an introvert, or if I want to engage with people. It's a question of moderating it, right? Given the social conditions, and under the given conditions, how can you moderate and temper people's behaviors, right? Whether it is through coercion, law is a codified form of coercion, or through social norms that Pavan talked about, right? If you take the example of tobacco use, right? I mean, I keep going back to it because it's probably one of the best documented in the literature, right? So smoking, I think is a social enterprise. People have smoked, it was very well accepted. And we have identified stress is one of the reasons, not the reason, people engage in tobacco use or smoking. However, over time, it's a combination of social norms and laws, right? It's not one or the other, right? That actually allowed us to bring down the rates of smoking. We haven't eliminated it, but we have brought it down, from 50-60% of the people smoking to, depending on where you are, almost 10% in some countries. So the point is we do have lessons, right? Where through communication campaigns, we can moderate those behaviors, promote those norms, but norms without laws are unlikely to work. Laws by themselves without those social norms will become very coercive and repressive, right? The question is, how do we do both at the same time? And that takes time. That's what I was referring to. The challenge we are facing here is all of that has to be done now, right? In the short term, that's what we are trying to do. And that's where I think, we need to spend some time thinking about.
So can I quickly jump into sort of extend Vish's point here about how formal institutions and informal institutions can co-jointly work effectively. If it is possible to bifurcate the monitoring component to the social norms part, and if we can continue to let the sanctioning part reside in the state, then we might be able to come to some kind of an optimal agreement between the two. And Vish is absolutely right. Formal laws, the implementation of formal laws is often subsidized by the existence of good social norms, and social norms without the recourse of formal due process of law can quickly degenerate into vigilante justice and kangaroo courts. I'll pause.
But I think there, sorry, yeah, just thinking, Pavan, about what you just said, there's sort of an intermediate point as well, which is, I'm just thinking, for example, with mask use and the intermediate point being buildings, which can say you cannot enter if you don't have a mask on. And so that starts to build out that norm. So it's not really the individual trying to enforce it, nor is it the state enforcing it, but it's somehow at some intermediate point. And I think there is an important role in that. And the state can be the one who empowers that organization level to make that requirement.
Right.
Yeah. So
on that.
Yeah. And I had one other thing to something you had said much earlier about in terms of the choice architecture and thinking about the fact that those nudges can't work in quite the same way in this case, but I think there is a lot more that can be done about facilitating the behavior, because we are asking people to, for example, wear masks, and not everybody has a mask, not everybody has a sewing machine, not everybody has a relative who can make them a mask. And so, how do we make those face coverings completely 100% accessible everywhere in a safe manner, including the disposal of them? And similarly on hand hygiene, like how do we make the ability for people to practice good hand hygiene just so completely widely available and accessible with soap and running water everywhere?
Thanks for all those comments. Now, I actually wanted to talk about another important topic which we have not touched upon now, and I think which you mentioned was around stigmatization. The problem that you do all this, there's high risk perception, but then it leads to stigma, and it's stigma so that you don't report the disease when you have it, and stigma in the sense that you act in different, not such good ways with the the health service and the health providers. So how do we deal with that problem once the lockdown opens? How do we ensure that this doesn't sort of undo a lot of the good that has been done? And this is for all, so it's not for anyone in particular. Whoever wants to jump in.
Another tough question from you, Pooja. To fight stigmatization, to fight discrimination, whether it's racial or gender-based, is a huge, again, mammoth challenge. And I'm not quite sure if it is conceivable to transform social norms. And you have social norms not merely challenging these forms of discrimination, but you also have social norms which support these forms of discrimination. To transform these inherited set of prejudices in a short span of time is going to be very, very hard. So I mean, a dependence on social norms and nudging, I think needs to be, in some sense, we need to get a little more humble about that, right? I mean, if there's discrimination, you can't completely abdicate the responsibility. The state can't completely abdicate the responsibility of protecting the state merely because there are social norms and merely because there are nudges, right? Ultimately, I think if there is discrimination and if there is a form of violence that is being perpetuated against certain members of society, I think the law needs to step in there. You can't just rely on social norms and expect people to become morally upright overnight and then not engage in them. So I still think that some of these things, some of these basic protections of rights of individuals is still under the purview of law, under the ambit of law.
Just to add to that, I think it's as Pavan said, it's such a complex issue, because when you bring in punishment and law, decades of research shows that punishment is not an effective deterrent over a long period of time. People only respond to punishment, the threat of punishment, if they think they'll get caught. So I think that's something just to keep in mind. I think it's definitely one way to do that, but there's a lot around that as well in terms of how effective it is. I think when I think of stigma, also what comes to mind is what's currently happening in the context of India, which is stigma around mental health. And I read a number of stories of, during lockdown, individuals who needed, in rural parts, who needed to go to get psychiatric medicine, and they were being stopped by police who didn't see that as a legitimate reason to actually kind of break the law and the social distancing rules. And so I think when we think about stigma at that level, it's what we really need to, and we've talked a little bit about community. Vish mentioned the importance of communities. How do you mobilize the community to start kind of vocalizing messages, consistent messages against that stigma? And in the case of mental health, in India, there's a huge treatment gap between the number of professionals and the number of people who need medical assistance, psychiatric help and support. And the only way to really get around that is to invest in those resources. And for that, there needs to be a mobilization of the community. Otherwise, it's just not going to work, especially in rural parts of the country where they're just not going to be able to access those services.
No,
Thanks, Sanna. Sorry, because we were short on time, I wanted to at least take a few of the audience questions before, so we don't let you go before we do that. And there's an interesting question for Professor Vish on this, which is, due to the lockdown, global economy has taken a hit while trying to reduce COVID infection. So what could be some strategies to balance the risk and caution messaging while signaling quicker rewards to economic activities?
Yeah, I think if I had an answer to that question, I could become a high-priced consultant. Given the entire world is raising that question, I think. This has become a huge challenge, I think, as we begin to unwind the way this is being framed is very interesting, right? The framing is either or, and it is either shelter in place, lockdown, stay at home, shut the global economy, killing jobs and halt, bringing the global economy to a halt, or it is public health, it is lives, etc. I think what we begin to need to do is to begin to change that frame, this either or frame. Comparative frames are never good. We always lose when we start using comparative framing in communications in general, So, and doing that kind of a juxtaposing economy and jobs versus lives, I think, is actually is a losing proposition. It is true that given the impact on the economy, there will be huge costs. Mental health, as Sanna mentioned, is one of the biggest costs, but also, poverty is one of the biggest determinants of illness and health. And I think, people falling into poverty is very critical. So I think the messaging is very critical. It's not either or, it is both. I think when you have elevated threat, in the absence of vaccination, in the absence of treatment, right? These are the two important things in this context. There's no treatment, there's no vaccination. You have to be compelled to take certain steps. And I think over time, you can experiment with easing off these so-called shelter in places or lockdowns and see what is going to happen. But it's absolutely important. I totally agree. There is no simple answer to this. But one of the things we should stop doing is this kind of a framing this as either or one against the other. I think we are not going to win, and actually will encourage people not to comply with these recommendations and mandates.
Thank you for that. I think somewhere similar, there's also a question, I think it comes from Divya, and we've talked a little bit about it, that there is a sense of fatigue that is setting in with the barrage of information. And now there's almost a kind of sense of fatality, and that probably gets enhanced when, you can't actually do those behaviors. So how do we balance against this? What do we do to prevent this fatigue from setting in? This is, Elizabeth, for you, as well as, anyone else who would like to comment.
Thanks. I think that's one of the important lessons about that, is to keep things fresh. And we can't just settle on some one thing and think that's going to address everybody for all time. I think what Sanna has been describing around the audience segmentation is an important aspect, that we can make sure that any messaging that we're doing is directed at specific audiences according to those profiles. But at the same time, we have to keep things fresh and continue to respond to the changing situation. As we've observed, the science keeps revealing more information, and as we learn more, we need to make sure that we're providing people with the most up-to-date information around their behaviors.
Yep, keeping it fresh, and we have to keep it fresh for a pretty long time. There's also a very interesting question from Sunil, and maybe Pavan, I'll direct it to you, that he says, I don't think we should discount incentivizing behaviors as a strategy, and organizations like retailers have long used reward programs to build loyalty and nudge behaviors. So could we not use intrinsic and extrinsic reward mechanisms as a part of this behavior change model? I mean, where do rewards fit in? We talked about sanctions, but can rewards be built in?
Yeah, you could use rewards. I mean, rewards are very effective instruments of behavior change. But rewards, giving out, somebody needs to pay for those rewards. And paying out for those rewards can become a very expensive proposition, right? So the sheer economics of incentivizing appropriate behavior would become, would lead to perverse incentives. I mean, people will start threatening you with bad behavior unless you reward them. people will threaten to steal from you if you don't reward them for not stealing from you. So in some sense, you are led to a very paradoxical outcome, which is people will continue stealing from you. So incentives against bad behavior are likely not to work too well. Right? It's the sheer economics of crime which will tell you that. Right? So anyway, I'll pause there.
Question for Vish. I mean, you talked also about, work of science being scrutinized at a very intense rate, and a lot of papers coming in, often they're not even peer reviewed and so on. So are there any lessons for, for how to communicate even scientific findings so that it does not lead to actually people discounting, things completely because something they heard yesterday, someone tomorrow tells them it's not true, it could lead to discounting of a lot of findings which are actually good. So how should the scientific community think about, communicating things about this pandemic, when they're talking to more general public?
So this is a huge issue. I think, in fact, I mentioned this before in another context. The National Academy of Sciences actually is spending a lot of time. There is a standing committee on communication of science. So what happens with science communication is when people perceive these findings, these results from scientific studies, generally it happens over a longer period of time, as I said before, right? So if you are looking at the impact of, unhealthy eating on cholesterol and then heart disease, this takes over a period of time. And nobody pays attention to each individual study as much as a group of studies when they are covered. And people always say, well, yesterday you said, eggs are bad for me, but today you're saying eggs are okay. So I complain that, scientists can't make up their mind, but that takes time. It doesn't happen in accelerated time. But what is happening now, I think the science, basically the way science works, as everybody knows, as people at least here know, that it's a cumulative accumulation of knowledge, right? So it takes over a period of time. And it's very messy. Each individual study may disagree, agree, there are what we call as null findings. But the body of knowledge, the consensus we develop is over a period of time. And not a lot of people pay attention to individual studies disagreeing with each other, right? There are some, but not enough. But I think in this context, I think this disagreement is public, right? That's because in discordance between studies is public. And, and this is not at all unusual, right? Just that scientific studies conflict and contradict each other is not at all unusual. But because it is so much in public, people are forced to think these scientists can't make up their mind. And we never make these kinds of guidelines and policy decisions based on science so quickly. We wait for 3, 4, 7 years before we make those decisions. But we are making those decisions of policy right away, right? Face mask is a great example of that. I mean, the mess we made around recommendations of face mask is an excellent example of how taking policy decisions and recommendations when science is still evolving suggests how difficult it is. And I think this is where I think we need an engagement. That's what I keep saying. It has to be a participatory approach. We need an engagement. This is where we need to work with reporters and scientists together, and institutions that conduct this science to say, what is it you need? Some of you know, we created a COVID-19 dashboard on our various sites. The reason is people don't need to know every scientific finding for their day-to-day behavior, right? I think all they have to do is follow when there is a consensus, right? So because scientists do disagree. So it's very important for people on the people side, it's important for them to say, I don't need every new finding that's coming out every day. What do I need? Just enough to get through my life because I'm very busy with other things, number one. Number two, working very closely with reporters, institutions, journalism, as well as scientific institutions. What can we cover? What can't we cover? And third, at a long term, and continue to teach this kind of a scientific literacy and research literacy of how science works. But this is not going to, I think again, the challenge will remain how these recommendations, that's when I said humility, that's what I meant, because I think we will get a bunch of things wrong. And saying that we will be wrong is very important. What have we learned from public communication of crises? Transparency, and going out and saying, we know this, we don't know this, it could be wrong, and going on with it.
It's an interesting point on consensus and how we should be looking at where consensus is versus every individual story. So now I know we are running short of time, but there is a request from the audience for examples, and especially the question comes for the panel that we've talked about how difficult this situation is, and communication is, has been quite complex. But are there any examples that you have seen of good communication on the subject from anywhere in the world today? Or if not, do you have a suggestion on what could be, if there was a single message that you had to give out, what could that look like?
I'm not sure I could come up with a single message, but I will mention that there are actually lots and lots of good examples out there. And as Vish mentioned, I think it's Harvard that did the dashboard. Johns Hopkins has also put together something which is called the COVID-19 Communication Network, which is a curated resource with all the best of the examples for messages. And I don't know, maybe I'll be able to add that link to the chat box, but it's COVID-19 Communication Network is the website. And it's a curated resource that has all of those examples from around the world that really are the best of the best. So I would encourage people who are looking for those kinds of specific examples that they could look there. And I did want to add also, Vish, about that complexity, and even for program people who are in the front line in every country in the world, there is so much information that is flying around out there that even program people have spent so much time trying to decipher what are we supposed to be telling people. And so on that COVID-19 Communication Network, there's also a synthesized guidance document that has called through WHO, the US CDC, and the other trusted sources to come up with the synthesis of that information. So as people are developing their messages, they're able to turn to one resource that has pulled together the most up-to-date information.
Pooja, can I jump in and add a couple of sort of quick comments about what kind of messaging is likely to work? The first sort of input comes from, again, Christina Bicchieri's work, and she categorically states that moralizing is not going to work if you're trying to set norms. Stop moralizing, because people are under too much stress to become moral. Second rule of thumb to follow is to declutter the number of messages. I think we really need to reduce the number of messages that the government at least is sending out. The third one is information is not going to cut it. We need affect, right, in our messages. Maybe testimonials from actual patients who are suffering. That might have a greater impact than just providing information. And finally, from our own few experimental, quick and dirty experiments that we ran, we discovered that fear-based messaging is likely to be more effective than pro-social behavior-based messaging. And that's kind of telling. Maybe when people are enduring cognitive load, you can talk about it from the point of view of scarcity, they really don't have the patience to be told about pro-social behavior. And they're more likely to respond to fear. So you can use a standard set of tools from the behavioral toolbox to design better message.
Just to add to that, actually, I think when people are much less likely to follow rules when they see that there is wiggle room, for deviance. And I think when a rule or a message is more absolute and directive, I think that's when behavior kind of falls into place. And if people see flexibility, that's when there's going to be more likelihood of people trying to game it or circumvent it. So I think to Pavan's point, I think fear does work in many cases, as well as just being quite directive.
Thank you. So I know we have 1 minute, so we have to end at 8 sharp. So I'd just like to thank everybody for this incredible discussion. Clearly, the task ahead is hard, and we have raised a lot of questions. Now, we are, of course, dealing with the triple whammy. There's the pandemic, there's the economic impact from the lockdown, and then there's the negative impact on other health issues. And some of the things we've heard today, sending out clear, actionable, directive messages, enabling new social norms, and creating a sense of collective responsibility will be few things we need to win the battle ahead, but without it becoming, turning into vigilante behavior. Perhaps in this journey, we learned something about ourselves too. So I'd like to thank everyone again, and just one more thought that we will share the recording of today's session on our YouTube channel and website. And we'll also have more behaviorally speaking webinars coming up in the coming months. So please follow our Twitter handle, CSBC_Ashoka Univ, to stay updated about the next one. So thank you all again for all the time you've given, and have a good night.
Thank you.
Thank you so much.
Thanks, Vish. Thanks, Sanna. Thanks, Elizabeth. And thank you, Pooja.
Thank you.
Thank you all.